Okay. So today we are going to start the International Classification of Disease, 10th revision, clinical modification. So normally the whole world use ICD-10, okay, which managed by WHO, okay. But US use ICD-10-CM, okay, which managed by CMS, Center for Medicare and Medicaid Services. So what US do, they make some changes according to their requirement. Okay. So CMS stands for Medicare and Medicaid services. So Medicare is federal government service and Medicaid is state government, like central government and state government. Okay. Changes happen each year on 1st of October. Okay. So now the new big book for 2026 will start implementing from 1st October 2025. So what changes has been done? Some codes added, some deleted, and some revised. Then we have ICD-10-CM structure. So what we have in ICD-10-CM? So we have 5 things in ICD-10-CM. We have alphabetic index, we have neoplasm table, we have drug and chemical table, we have external factor index, and we have tabular index. Okay. So let me show you the ICD-10 first. Okay, so this is your ICD-10. This is 2024 version, but you have 2025 version. So in starting, you will get ICD-10-CM guidelines. Okay, these guidelines we will discuss in detail. Okay, once your guidelines will be over, then you have some anatomy. Okay, so I told you that there will be 8 questions in your CPC exam, but CCS hardly there any question from the anatomy. So if you are not remember anything, then what you can do, you just go through your ICD book. Hai. You will follow every artery, every bone, okay, or any joint. So you can check over there. Okay. Chamber of heart. Then chamber of the heart, valve. So everything you will found in the ICD book. Okay. Whatever it like there are 4 part of the colon. So if anything come in your exam, so what if you remember thing, you can save your time. Yes. So time is very important either in the CCS exam or the CPC exam because it's an open book exam. So everything is in our book, but we cannot depend on book. Yes. Okay. So we need to learn so that very few time we need to refer these which we are not able to identify. Okay. So whatever time you will save, you feel comfortable during the examination. Okay. Otherwise everything is there. Yesterday we discussed the endocrine system, how many glands are there, or the ear anatomy, or even though the eye anatomy we have. Okay. So everything we have here, female reproductive system. Okay. So every anatomy you have in your book. So first, from where we started, the guidelines. Once the guideline over, we have anatomy in our book. Okay. Now from here, ICD-10 start. So what is the first thing? Alphabetic index. Okay. So what you will found in the alphabetic index? Alphabetic index we use normally like a dictionary. So in dictionaries, if I have to search the market, what is market? So I need to go the M, then A, then R, then K, then E, then T. Similarly, we will search any disease in alphabetic index in the same way. Okay. So the alphabetic index work as a dictionary. And how you need to search, we will let you know. Okay. So once your alphabetic index completed, okay, you can check in your book also. Okay. So once your alphabetic index completed, you will found new plant table. Check that whether you are able to find the new plant table or not. So this is alphabetic index is going on. So once Z came, okay, Z is the last letter of the alphabetic index, then you will found the new plant table. Okay. So we have alphabetic index and then we have new plant table. Okay. Then third, what we have drug and chemical table. Okay. So once your new plant table will complete. Okay. So I'm just going to scroll some more pages. Okay. Then we have drug and chemical table. So check that. Are you able to get the drug table? Okay. So you are able to identify, get the alphabetic index. You are able to get the new plant table. है ना? Then we have drug tables. Okay. Once the drug table complete, we have external factor index. Alphabetic index for external factors. Check whether you are able to identify get this page. Okay. External factor means if somebody hit by any car or burn or fell down, any external cause of injury. Okay. So any query till now, alphabetic index, new plant table, drug table, and external factor. Then we have tabular index. Once this external factor index will done, we have tabular index. This one, tabular index. Got it? Flip more pages. Flip more pages. Hmm. Yeah, from here on. Again, tabular index start with the A. So first you will get all the code which start from the A, then B, then C, then D, then Z. Okay. So we have 5 things in your ICD book. Alphabetic index, new plan, drug, external factor, tabular index. So I am giving you 2 minutes. Check all these from the starting, whether you are able to find or not from the starting. So suppose if you open your book, so first where you need to go the
Index. Index and guideline.
First you need to go to the alphabetic index. Okay.
Alphabet.
Yeah. So check all whether you are able to find all these 5 or not in your book. Quick, do fast. Now what you are searching?
Alphabet.
This is alphabetic index.
This is
Okay. Then what you need to check next? New plan table. Yeah. So alphabetic index will start from A and end with Z.
Yes.
So once you get the Z, then your new plan table will get started. This is A. This is L. This is U. Hmm. This is drug and chemical tables. Third one. Before that, you have new plan table. This is new plan table. One more. Okay. So you need to flip couple of times. Then you will know that where you will get these all index. Okay. So are you familiar now with the indexes in tables? Any query?
No.
Okay. So what is important steps in ICD 10 CM coding? Okay. Step one is search in the alphabetic index first. Okay. And step two, confirm the code in the tabular index to ensure whether it's a valid or invalid. Okay. So whenever you get any diagnosis in medical record, then you always need to search things in where alphabetic index, not in the tabular index directly. Okay. Or in the new plant table or in the drug table. Your first action will be always search disease into the alphabetic index. Okay. Then you need to confirm the code into the tabular index. Okay. To check whether code is valid or invalid. So what is valid or and what is invalid? Okay. So what is your name?
Vinay.
Vinay. That is invalid name. Why it's invalid? No. If I say I am Vikas, my name is invalid because my full name is Vikas Maheshwari. Okay. So until unless I did not tell somebody my full name, है ना, then it's an invalid name. Okay. So whenever you say anybody to your name, you need to told full name. Okay. Okay. So what happened that the ICD 10s are 3 to 7 digit codes. Okay. ICD 10 CM are 3 to 7 digits. 3 digit name, 3 digit code is also valid. 7 digit also code is valid. Okay. So there may be some people whose name is only Vinay. They do not put surname. In North, you will found so many people. They have only single. There are so many Monica, only Monica. Sonam, okay, Ravi. Some people put their last name Kumar, है ना? So if somebody only have name Vinay, that is valid name. But if his name is Vinay Kumar and he telling his name is Vinay, then it's invalid. So what you got? If there is further extension is there, then you need to code as per the highest specification available. So if you have your first name, middle name, and surname, you need to tell all three names. Sachin Ramesh Tendulkar. Okay. So it's a full name and complete name, invalid name. Some people say Tendulkar, some say Sachin. It's a invalid name because he has middle name and he has surname also. Similarly, in ICD 10, we have 3 digits codes, we have 4 digit code, we have 5 digit code, 7 digit code also. So we only provide the valid codes. Okay. If we provide the invalid code, the insurance company deny. So where we will identify that whether code is valid or invalid? In tabular index. Okay. So just go to in your tabular index and check B20. Okay. B20. I will show you. Okay. In my screen. You can also flip your pages. Okay. So check B20. Check on your screen. Are you able to see the B20?
Yes, sir.
Okay. So this is a valid code. It's a 3-digit code, but it's a valid code.
Valid.
Okay. Then we have 6-digit valid code M25.561. Okay. So now we need to check M25.561. I need to go the M25 point. Okay. Check this M25.5. This is 651. We need to check 561. Okay. M25.561. Check on your screen.
Digit code, no, sir.
6-digit code M25.561. Okay. So it's a valid code.
Valid.
So the 3-digit V20 code is valid code and 6-digit code M25.561 is valid code. Okay. Now, invalid codes. है ना?
Yes.
V25. Okay. So now we need to check V25. Okay. So what V25 say? Are you able to see anything written before V25?
Before B25, fourth.
Fourth.
Yes, sir.
That means this code is invalid. If you see B20, nothing is written before B20.
Yes.
Nothing written, na? That is valid code. But in B25, it say fourth. So that's mean the 3-digit code is invalid. You need to complete with 4th digit.
Okay.
Now you see that 4th digit, there is nothing written. So that's mean these codes are valid codes. So the B20 is 3-digit code, which is valid code. But B25, which is also 3-digit code, that is invalid code. But B25.0 is valid.
Valid.
And we always you need to use valid. So that's why we need to refer tabular index. Okay. Now I show you the 4-digit invalid code. So B27 is how many digit?
3-digit.
And what did it say?
Before it is showing fourth.
That's mean the 4-digit required. Now we have B27.0. How many digits are there?
4 digits.
4 digit. But what mentioned?
Fifth. He is also invalid.
It is also invalid. So we always use valid code. And in ICD 10, after first 3 letters, there is always point. Okay. So that's why B27.0, B27.00, B27.01. So these are the valid codes. Sometimes you will found 5th-digit code are also invalid. How many digit codes is M 0.605?
6 digits, sir.
So M 06.05, fifth digit code, what's its invalid code? Okay. So tabular index is very important to quote whether to check whether code is valid or invalid. So how you will know? A three-digit code may be valid if no further extension is required. A six-digit code may be invalid if a seventh character is required. So three-digit code be valid and six-digit code can be invalid. So it's all about extension required or. So are you clear with that? Valid code or valid? And we always use valid code. Okay. Now, ICD 10 cm code classification by first letter. So suppose there is a 5-year old child. And so if he want to read newspaper, so how he can read the newspaper? He learn from the alphabet. First he need to learn alphabet, then
Quotes.
words, then sentences, then paragraph. Na? Then only he can read the newspaper. Similarly, first I need to tell you the alphabet, then the word, then sentence, then paragraph. So paragraph is your report reading. That is the final step. Okay. And our ultimate goal is report reading. So for that, we need to first learn the alphabet. Okay. So if any ICD start with letter A or B, it's a infection. Infection can be viral infection, it can be a bacterial infection, it can be a fungus, है it can be sepsis or microorganism. Okay. If any ICD code start with C, that's mean cancer. Okay. If it start with D, it can be tumor, it can be a benign neoplasm, it can be anemia or any other blood disorder. Okay. If ICD code start with E, that can be endocrine disorder, which is diabetes, thyroid, है F is psychiatric disorder. Okay. So if somebody is smoking or drinking, so that is psychotic disorder. Because if somebody is very used to smoke, है then he said, I will not smoke, then I will get something. Okay. My mind is not working. I have severe headache. So that is psychiatric problem. So all the psychiatric disorder falls into the F. Nervous system disorder we have into the G. Okay. Eye and eye and ear diseases like suppose blindness or deafness, they will fall in H. Then we have cardiac disorder like hypertension or myocardial infarction, any valve disease, okay, coronary artery disease, all the disease will fall in I. J, we have respiratory disease. Any disease which happen in the trachea, bronchus, lungs, okay, they will fall in like asthma, COPD, chronic bronchitis, all these fall into the J. Digestive system, all intestinal disorder, esophagus, gallbladder, pancreas, colon, rectum, okay. Every disease from these organ like uh, diverticulosis, esophagitis, hemorrhoids or colon polyps, or everything will be fall into the K. So K. Respiratory system is J and digestive is K. So suppose if there is mentioned the gallbladder stone and your code start with the T, U, V. I know that without reading whether you search right or not, I know that your code is wrong. Because if any disease belongs to digestive system, your code should start from the K. Whatever you say, okay, I have searched this there. So there is something wrong to navigate your code. Okay. So it will very helpful. Okay. Then we have musculoskeletal disorders. Okay. Like spondylitis, disc displacement. Okay. Disc degenerative or the osteoarthritis. So all these diseases are into the M. Then we have urinary reproductive system, male and female disorders. And so if there is a kidney stone, then it start with the N. If there is a gallbladder stone, it start with the K. And if there is a bladder stone, then N. Because bladder is stand for urinary bladder. Until unless they say gallbladder. Okay. Then we have pregnancy related complications. If somebody is pregnant and he has any disease, he or like she has any disease, then the code will start from O. Okay. Then we have congenital disorder. Okay. So what is, no, sorry, P, neonatal. So neonatal up to 1 month. So if the child is up to 1 month, we will use P. All ICD which start from with P.
Related to that.
Up to 1 month. If somebody have any disease up to 1 month, we need to take neonatal code. Okay. Not all neonatal codes are available, but whatever neonatal codes are available, we need to take that code only. Q is for congenital disorders. Yeah, by birth condition. If somebody have like atrial septal defect by birth, so atrial septal defect is always by birth. Okay, then it's start with the Q. So there are two things. One is congenital and one is acquired. Acquired means after birth. So if somebody have four finger in his hand, then it's congenital by birth. And if somebody lost one finger in accident, that is acquired. Okay. So you need to check that whether it's the condition you are coding acquired or congenital. Sign and symptoms. So if say chest pain, shortness of breath, abdominal pain, so all these fall into the R. Then we have injuries, fractures, trauma, wound, है ना? They fall into the S. Then we have poisoning, burns, postoperative complication in T. Then earlier there were no U codes, but we only have COVID-19 codes. That's why the COVID-19 code after Z codes. Okay. Then we have external cause of injuries, VXY, VXW, UVXYW. U so VWXY. Okay, so V2Y. So there are four. So then we have JAD, history, status, vaccination, follow-ups. So if you remember these, then it will be give you the good help. And if you not remember, still you can search the ICD code. Okay. Now, so we all know that who manage the ICD 10 cm, है ना? When the ICD changes happen, okay. Then we have this valid code, invalid code. Okay. Now we need to check how to search ICD. Now we need to learn how to search ICD-10 code. Okay. So there are some rules. Okay. First, you need to identify the disease. Okay. So how will identify the disease? So I am just saying that congestive heart failure. Congestive heart failure. So there are three letters, three words: congestive, heart,
failure.
and failure. So heart is organ. Congestive is type. And what is disease? Failure. So failure is disease. So if I need to search congestive heart failure, I always go first failure. Okay. So in alphabetic index, what I need to do? I need to search failure. Okay. Then the second step, what we need to do? Organ or organ system. Okay. So what is organ? Heart. So under the failure, I need to search heart. So always search heart where it's start, not the continued. Okay. So where the first time heart is mentioned, because first never go. Okay. So I will tell you that how to search. Okay. So the organ, then we need to search the organ. Then we need to search the anatomical location, upper, lower, right, left. Then we have severe to also. Okay. And then we need to verify the code into the tabular index, whether it's a valid or invalid code. Okay. So now we need to go search the liver failure. So first you need to go to into the failure. So I will show you that how need to search. So first I need to identify the disease which is failure. Failure. So always make a rule, always start where the failure started, not anywhere where you got the failure. So just go to in your book, search failure, where the failure started. Failure. Okay. Now ABCD started. Now we need to go into the L. Okay. Liver. We got heart. Not that much fast. Slowly. Failure. Liver. Okay. Are you able to find? Just check your screen.
Yes.
No, not like that. Okay. Just check your screen. Okay. So what it's mentioned here? Failure. Okay. ABCD started. Where I need to go? The L. Okay. So this is D, H, 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 I, K, L. Now, similar manner, you need to search in your book.
Yes, sir.
What's mentioned?
Liver C failure
Hepatic.
hepatic.
Okay. So we are already in failure. We search liver, but the guideline states, see failure hepatic. Now we are already in failure, but now we need to check in H.
H.
Because hepatic start with the H, na?
Yes, sir.
So now we go, है ना? Hepatic. It's hepatic, not continue from the where the hepatic start. Okay. So what is the code? K72.90. Okay. So anything else mentioned?
With common.
No. We only have acute liver failure, है ना?
Yes, sir.
So now we have failure liver. Now we need check acute. So are you able to see that?
Yes, sir.
Acute or subacute? So what is the code?
K72.00.
Okay. So we got our code K72.00. Now what we need to check in tabular index, whether it's valid or invalid codes. Okay. So just go into the tabular index and check K72.00. This is I. This is J. This is K. K11. K62. Now you will find somewhere K72.00.
00.
Yeah. 0 is invalid, na?
Yes, sir.
We got 0 code, na? K72.0 in alphabetic
Yeah,
index.
K72.00 is a valid code.
Valid code, na? Because there is nothing mentioned in front
Yes, sir.
of that code.
Yes.
So what will be the code for the acute hepatic liver failure? K72.0. Any query question?
No, sir.
No? Are you able to identify how to search this?
Yes.
Okay. Now, second example. What's mentioned in second example?
Coronary disease.
Coronary artery disease. So what is disease? Disease is disease here. Okay. So where we need to go first? Disease. Okay. In alphabetic index.
Yes.
I am in disease. And always from where disease started. You need to go where the disease started. Now, what we need to search in disease? So what is our question is coronary artery disease. So the main term, the organ is artery. So first we need to go in disease artery. So ARTERY. Okay. Artery.
Yes, sir.
Under the artery, you need to search the word coronary.
Oh,
Have you coronary?
yeah, found, sir. It's 125.
Not 125. First letter is always start with alphabet. What is? No, that's fine. You'd say 125. So I am just saying it's not 125 because first letter is always alphabet.
Okay, it's I7.
I 25.10.
Yes, sir. I-25.
Okay.
Yeah.
Now you need to confirm whether I 25.10 is valid or invalid.
No, invalid.
L K yeah. K it's K. Mhm. You have to search na I 88, but you need to go I 25.
I-25.
I 25, not 125. One zero. I 25.10. So it's valid or invalid?
Valid, sir.
Valid, na? Okay. Now I am giving you 10 minutes. Okay. You need to search these codes, whether you are able to identify got these codes or not. Here is the condition, and you need to search. So your code should be matched with these codes.
Okay, sir.
Okay. So I am just giving you 10 minutes.
10 minutes.
I am giving you 15-20 minutes.
Okay.
No issue.
Found in
So you want upper respiratory, acute upper respiratory tract infection. Okay.
sir, I
So
found only
okay.
five of it.
Okay.
Maybe
So first you need to go infection. 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 Okay. Just see your screen. Okay.
respiratory.
Tract we already have in the bracket. Then we have upper, acute. So now every word covered. Nothing left. What is the code? 06.9.
Yes, sir.
Okay. So respiratory tract is already there. Then we need to go upper because I told you that third portion is anatomical location, upper, lower, left, right. Then only the severity, acute. So what you are doing the mistake, which mistake you are doing? You are doing this mistake. So respiratory tract, you found the acute.
Yes, sir.
So you stop here only. So first you need to find the anatomical location, which is upper, then severity, acute.
Okay.
Got it?
Yes, sir.
Any other difficulty you found?
Maybe I think I found a invalid one.
This is valid code. Okay.
It is sixth one.
Sixth one,
Uh,
chronic diastolic failure, heart failure.
yes, sir.
Okay. So first you need to do the failure. Failure. Okay.
Okay.
Then we need to go heart. Heart. And then we know we need to go diastolic. Diastolic or systolic? Diastolic. है ना? So are you able to see the diastolic?
Yes, sir.
Under the diastolic, there is a chronic.
Yes, sir. Chronic.
And the code is I30.32.
Yes, sir.
And this is the code which we have, I50.32.
Yes, sir.
Now you need to check it's a valid code. Valid code. Got it?
Yes, sir.
Okay, now. So what we learned, what the key takeaways, always refer alphabetic index first.
Yes, sir.
Always refer alphabetic index first, then confirm it in the tabular index. Use only valid ICD-10 CN codes. Okay. Understand how to search code by disease, then organ system, then severity. Okay. So these are the basic guideline how to search the ICD codes. Okay. Then we have guideline NOS. That's state for not otherwise specified or unspecified. Okay. An NOS unspecified code is used when a physician documents a disease but does not specify details such as anatomical location or severity. Okay. Even though, so if I say abdominal pain, so I am not saying that whether pain in upper quadrant of the abdomen, right upper quadrant, left upper quadrant, right lower quadrant, okay, left lower quadrant. Or if I say knee pain, which knee? Left knee or right knee? So if physician did not specify it, okay, so you will always get a code of unspecified. but most of the time insurance company deny the unspecified code. Okay. So did you get my point that when to use unspecified code?
Yeah. Either they didn't mention left or right, upper or lower.
Yeah. So, but you have code for that.
Yeah.
Okay. So in that case, you have to take the unspecified codes. Okay. And NEC is a little bit different. In NEC, they specify, but there is no code available. So physician says that, okay, right, sorry, physician say upper abdominal pain. You have right upper quadrant, you have left upper quadrant, but you do not have upper abdominal pain. But physician is specifying. In that case, what we need to take? Other specified. So there are two things. Unspecified, when the physician did not specify, and other specified. When physician is specified, but we do not have code for that. In that case, what we need to take? Other specified codes. So when we need to use take unspecified code?
Uh,
Unspecified. But if they mention, but the code is not available, other specified. In that case, what we need to check? Other specified. Okay. So like if you search lower abdominal, example lower abdominal pain, you have multiple code in book. R10.111231, but you do not have lower abdominal pain. So what you need to take? Other specified. Any query?
we mentioned other specified.
No, he will. Then okay. So what happened that whenever you search the ICD codes, I will show you. Okay, so we have these codes available. Right upper quadrant, left upper quadrant. Okay, here in this we have lower abdominal pain code, but unspecified. Okay, so the example is wrong. Okay, I just lower abdominal pain we have. We have a code for lower abdominal pain. Okay. So what I need to do, I need to say left lower abdominal pain. So we have lower abdominal pain code, but not the left lower abdominal pain. Okay. We have lower abdominal pain, but not the left lower abdominal pain. Okay.
That means right abdomen.
But again, here we can take the lower quadrant, left lower quadrant pain. है ना?
Yes.
So the example is not fitting. I will check this example. Okay. I will change this example. But main thing is that if physician mentions something and we do not have code for that, in that case, we need to use other specified code. Okay. Any query question?
No, sir.
Then we have parenthesis, small bracket, है ना? In ICD 10 cm. So what is parenthesis? So you are aware about this bracket? Okay. That's we call small bracket. Okay. Or parenthesis. So suppose a physician mention anything. Okay. And when you search that in alphabetic index, mention in parenthesis, you will consider that term. And if something physician did not mention, but still it mentioned in bracket, small bracket, then you can ignore that. Okay. So just go to these guideline. Then tell me that what do you understand? ICD 10 coding parentheses are used to enclose supplementary words, also known as non-essential modifier. These words may or may not be present in the diagnosis statement, but do not affect course selection. So I show you the example. Okay. So what is mentioned? Hypothermia in small bracket accidental. So my physician either mention hypothermia. Still, take this T68 code because accidental is in bracket. So that is non-essential. And if my physician mention hypothermia accidental, still I will take this T68 code. Okay. So tomorrow we will continue the remaining guidelines or basic guidelines. Okay. Yes. So slowly. Okay.
Upday session, upday I'll
Hmm.
practice.
Hmm. So you can sit over here and do the practice. First, you need to go for
I'll wait, sir.
yeah, food.